At Maine Health, we are so proud to have worked alongside the American Heart Association to deliver 170 infant CPR kits at the Jewish Community Alliance Diaper Bank directly into the hands of parents. And pairing that with simple confidence-building education. It's a practical way to really engage with the community in the setting that they're already at, to really turn a moment of need into a moment of empowerment for them as caregivers. Cardiac and breathing emergencies don't wait for ambulances and for EMS to arrive. And so knowing CPR, especially infant CPR, can turn a bystander into a lifesaver in critical minutes. For new parents, the knowledge also reduces fear and builds confidence, especially at home, so they can respond quickly. And certainly if a child is choking or becomes unresponsive, can have life-saving minutes before professional help arrives. This work is really prevention in action. And by removing barriers, whether that be cost, time, transportation, and offering the training for CPR where families already go, we advance health equity, we strengthen safety at home, and that means fewer emergencies escalate, more people feel prepared, and we take a tangible step towards our Maine Health vision of working together so that our communities are the healthiest in America.
At Hannaford, we believe in the power of doing good in our communities. This collaboration with the American Heart Association helps expand access to health resources and education for individuals and families who need it most. In Maine, the rate of high blood pressure for the entire state is nearly 32% of the population. In more rural areas, blood pressure rates are often even higher. We would go in at rural food pantries and give people that don't always have access to that type of information, blood pressure cuffs, monitoring through the Heart Association where they could give them tips and guidance for managing high blood pressure in conjunction with our Hannaford dietitians that gave them healthy eating tips and some menus. I'm a heart survivor. It's been over 25 years. I live with a pacemaker and an ICD. I have a blood pressure monitor at home that I use daily. Not everyone's as fortunate as me or other people to be able to do that, so having it available at a food pantry is really a good idea in my opinion. It's about education and giving people the opportunity to learn at their own pace, have access at their own pace. We've made a commitment to our communities long before I even started with Hannaford, which was 43 years ago, that we're here for our communities, our customers, and our associates. So I think this might even impact some of our associates. So that's really important to me.
Well, recently we teamed up with the American Heart Association and donated blood pressure machines and educational materials so it would be available to the Greater Portland Health community, the patients they serve, giving them access to treating this risk factor in their homes rather than only during office visits. Blood pressure is often labeled as the silent killer. It's rare that you're aware that you have high blood pressure, yet it's one of the most important risk factors for heart attacks and strokes. So it's important to have a blood pressure cuff at home. We see that when you're at the doctor's office, you're there once or twice a year, you're nervous, your blood pressure goes up, and it's not necessarily reflecting the actual blood pressure. And it's not only one blood pressure. If you're diagnosed with high blood pressure, you also want to know if you're responding to the medication. So monitoring your blood pressure at home to give your doctor response feedback, this medication is working or it's not working. A big part of our job should be to prevent the heart attack. Identify it before it becomes an emergency or, you land in the ER with a heart attack or a stroke.